Now, Dr. James Mault, you are a good friend of M42 and our stage here. We were first on stage together at the Abu Dhabi Global Healthcare Week in May, in the capital of Abu Dhabi. But you have a very long-standing relationship with the UAE. Take us back to where that relationship began.
You know, remarkably, the UAE during COVID, I think, was the showcase for the world about how to take care of its population in a global crisis. And, you know, I brag about it all the time as though I was here, but, you know, the fact that the Emirates had the leadership and the vision and the execution to be able to test for COVID as pervasively as they did, and keep the population working and still operating in the operating room was truly remarkable. And a lot of it just came down to monitoring, right? And we're going to talk about that in terms of prevention. And monitoring and testing allowed, you know, the public health institutions here to be able to be very proactive in keeping the virus from spreading. So the Emirates had the lowest infection rate per capita, had the lowest hospitalization rate. I mean, it was just a showcase for the world. And it's really a reason we came here to be a part of a leadership that, and especially with M42 and Mubadala Health predating that, that could see how to take advantage of technology, apply it smartly and cost effectively, generate data, and then get that in the hands of clinicians to take better care of people.
I think it's really interesting to hear your perspective in terms of setting the scene on what the UAE has achieved. And it ties in beautifully for us to now explore the relationship with BioIntellisense. The segue, a perfect segue from the last session on Rhapsody and M42. Give us an insight in terms of your organization and the relationship with Rhapsody as well.
Yeah, so Rhapsody, I mean, I was thrilled to see this announcement just now because we've been working with Rhapsody. In fact, the working relationship that I've had with Rhapsody predates BioIntellisense back to Qualcomm 10 years ago. And Rhapsody is by far the most prolific data exchange engine on the planet. And we found tremendous benefit of being able to take advantage of the plumbing and the ability for us with this wearable to be able to get the data from the human body off this wearable into the cloud. But if you can't get that data into the hands of the clinicians, then you really aren't going to see much benefit. And so Rhapsody really facilitated the ability to get the data that you're generating off of devices and other data capture technologies and get that into the EMRs and get the other data coming out of the EMRs into these data sets. Everything we talk about when we talk about connected care is how do we rescue, and I do call it rescue, data from these trapped silos. You know, there's silos of information here in the pharmacy and there in the EMR and then in the physician clinic record. And so Rhapsody helps unify the ability for all that data to flow to different places. And only once you get that data together in one place can you kind of execute things like prevention.
And that's so interesting, and it connects to the word connected. It seems like we're making so many connections here on the M42 main stage.
Exactly.
Now, you modestly raised the button, but put it down. For our audience members who are not familiar, talk us through this device and your journey behind it and where we are today with this.
Well, yes, exactly. You'll see me wearing we all have wearables. Raise your hand if you have some kind of wearable. Just about, they're prolific. So I've got one on each arm in case you run out.
And maybe one on each ankle?
I don't know. You don't see my ankles. But, the point being is about 15 years ago, the Fitbits of the world started coming around. And, it really was a breakthrough for healthcare. In other words, prior to the onset of the wearables, we're in a state where there is a human effort to measuring something, even your temperature. You have to put a thermometer in your mouth, or you had to pay a nurse to take your temperature or take your vital signs. So, when we look at things in life, anything that requires effort, sometimes we don't want to make that effort. So when the wearables came around, there was a bit of an epiphany that we could suddenly all see how many steps we were walking without actually paying attention to it. So this is what we call passive data collection. And passive data collection is a big winner. And then not only could it measure how many steps you were taking, then a couple years later, it was measuring your steps and your heart rate, right? So in that regard, for the fitness and exercise people, it started to be really interesting. But when
the kind of data that up until that point, only athletes were able to access, presumably, right?
Yeah, and with a lot of effort and expense, right? To measure EKG or to have your finger on somebody's pulse. And so imagine, wearables suddenly said, we can measure all this stuff without any effort on the part of the user or healthcare professional, and that data can go somewhere so we can look at it, right? So that was kind of the beginning of BioIntellisense, where we said, okay, this is cool for fitness and wellness and exercise. Let's take it up a notch and turn it into what we call medical grade. Now, medical grade, for background, I'm a heart surgeon. So, when we start talking about medical grade, it means having a next level of clinical accuracy, but also what we call reliability. In other words, I'm going to start making life and death decisions based on the data that a wearable is generating. And so an FDA level clearance is necessary. So this is a continuous monitor. That's the other thing that the wearables did for us, is allow us to have continuous data instead of an occasional snapshot. So we have passive data collection that's continuous, and then you start doing multiple parameters, so multi-parameter, and then you make it medical grade. And so now what you have is something that's measuring a multitude of vital signs on every patient throughout the hospital, where for the last 100 years, we've been paying a nurse to walk around once every 4 to 6 hours. So this is game-changing just from a workforce labor cost. But now you're introducing continuous monitoring so we can see what's happening to every patient, every minute, every hour throughout the hospital, and then they go home with it. And so we can keep an eye on what's happening to you at home. And then things like Rhapsody allow this data to get connected to the electronic medical record. And then when we had Dr. Rue here this morning, we can start talking about how AI can watch all of this data. So now imagine in the hospital, we used, with a nurse, we had 4 measurements a day in 24 hours. With this, we have 1,440 measurements per day, per parameter. So you now have about 10,000 pieces of data per patient across the entire hospital. So it's almost too much information. And so with connectivity, we can take this to the cloud, and in the cloud, apply AI that can watch each patient for any signs of deterioration. And it's not just a single measurement, but we can watch a continuous trend. And so just to finish up, we're now doing over 250,000 patients, and we have over 2 billion data sets of every single vital sign, every minute on hundreds of thousands of patients. And we are now seeing things that no one has ever seen before. So we can see somebody deteriorating, not just when the code button happens, but 18 hours before a code. We just published an 87% positive predictive value that can identify patient deterioration 18 hours before they're going to code. And that's reducing transfers to the ICU, it's reducing length of stay in the hospital, and the work labor for the nurses has been reduced by 50%, all the while that we're giving far better monitoring. So it's, when we talk about prevention and connected care, this, 3 to 5 years from now, it's hard to imagine you would want to walk into a hospital and still rely on, oh, you still have that nurse once every 4 to 6 hours checking on my loved one? No. We want you to put on one of these buttons. Ready? There you go. You can pass it around.
I love that interactive nature. You say it's hard to imagine in 3 or 4 years' time, looking back on that data only being inputted every 4 hours or only 4 times a day. Take us back to the start for yourself. You mentioned very casually being a heart surgeon. Very modestly you refer to this, Dr. James Mault. I mean, that's fantastic. With your medical experience, your technological insight and expertise, being able to marry those two worlds together. Can you even imagine the present moment? When you were a young medical student, could you ever have imagined, fathomed being in this position?
It really is unimaginable, and yet, what we're looking at right now with the advent of AI is really just the beginning. What we're going to be seeing over the next 5 years, because of these data sets, so now we're going to, for the first time ever, and again, M42, and this is not false praise, M42 is literally leading the world in being able to assemble the most remarkable combined data set in the history of human health, with the genomics and the proteomics and the Malafi data set from the EMR, and then you start collecting the continuous biometric data from something like a BioButton. This puts these data sets together in one place, and now the ability to apply machine battery.
Now, is it better? Yes, good idea. No.
Is this one on? There we go.
Yes.
So now we have these amazing data sets all coming together. And again, Rhapsody makes that a part of the key recipe, because Rhapsody is the plumbing and the universal translator that allows these data sets to come together. So now you have these amazing data sets, and then you apply these machine learning tools to identify patterns. And honestly, with the algorithms and pattern recognition of AI on these data sets, we are now going to see this rapid acceleration of clinical intelligence, right? And that's what we've been all dreaming of, is, when you think about it, every airplane that any of us have stepped onto, every commercial airline in the world has applied AI. So how many people realize they've risked their lives depending on AI for decades? And that's this thing called the autopilot. The autopilot is literally looking at data from all the sensors throughout the plane And instead of the pilots having to watch all those numbers, the autopilot AI is watching all of that data and reducing it down to what the pilots really need to know while they're flying that plane. And that's what we're about to experience in healthcare. And if you look back to the 1960s and 70s before the autopilot system, there was one major commercial airline crash tragedy every year for every 1 million flights. And within 5 years after introducing the autopilot system, that dramatically changed to 1 in every 25 million flights, a 25-fold increase in airline safety because of the autopilot system.
That's such a profound analogy that you make, and I don't think I've actually heard anyone else draw that kind of comparison. And of course, no one, I'm generalizing here, and I think it's fair to generalize, would ever question the autopilot system. However, we are still in a situation, I'm not going to speak of our audience because they're a very smart bunch here, but there is a general consensus out there. There is a reticence to embrace a lot of clinical intelligence, a lot of AI in the medical sphere. In a way, there isn't in terms of that autopilot interjection in the aviation history. So why do you think that's the case?
Oh, isn't that interesting, though? And I think there's two things. I think in some ways we're our own worst enemy. I think we need to be careful, especially in healthcare. We need to be careful throwing around this phrase, artificial intelligence. I think it scares people. And you're right, that reticence that we're seeing, I think, is understandable. Artificial intelligence and
we should contextualize,
robots.
There is a lot of embracing as well.
There is,
but there is still reticence.
Right, and so when you look at the autopilot system, what you have to keep in mind is you still have those pilots in the cockpit. And that AI, or the autopilot, is a tool. What we want is to make every doctor and nurse and pharmacist look like a genius. We want to give them the tools to be better at what we do.
But we all think you're all geniuses. Come on. We do.
It's hard because there's so much data, right? We're smart people, but there's no way, even with the data that bio button is generating, that a human being, in the intensive care unit, we did this analysis, just the bedside monitors in the ICU are generating 1 million pieces of data per hour. No human being can process all that information. No. And so sadly, that data is just flowing by, and we don't see that this patient's going to crash in a couple hours until it actually happens. So AI is going to help us keep an eye on stuff, just like the autopilot system, and then bring it to our attention when something's heading in the wrong direction, whether that's in the intensive care unit or the things that we're eating, because we might get a genomic test that's now very easy to do, but now when we talk about personalized care, only an AI system is going to be able to look at our genomics and then what we've been eating for the last 6 months and give us some ideas of what we should be doing differently.
I think that's so super fascinating. There's so many points I want to unpack. But I'm going to pause for just a moment to say, if the audience have any questions, please put your hand up, because we have roaming mics. Maybe we should test you. Wherever the bio button is, that person has to ask a question. Wherever it is.
I like that.
I know, I try. But they're a friendly audience, so please have a think. I'll come back to you in just a moment. The point I want to unpack, you make some really astute points. One key word you use there is providing this, if we use the very generalized term AI, there's lots that comes under that. But let's just say AI for now, for the sake of this conversation, as a tool. Because you say it's a tool, because maybe that helps us break down the reticence is on one aspect because people fear that AI will replace their jobs.
Yeah.
And you're saying, hang on a minute, this is another tool for the nurse, another tool for the doctor.
Absolutely. Well, I mean, here's a perfect example, right? When we look at do you want to feel threatened by AI or do you want to embrace it? So as a clinician, we have these colleagues called pharmacists, right? So does it make sense for us to be paying the pharmacist? 20 years ago, we paid the pharmacist to count how many pills to put in a bottle, right? That's just not a great use of that skilled, highly trained professional. So we can automate a lot of these things, like the bio button is automating the vital signs and bringing it up to AI, and then we can tell the nurse, hey, this patient over here is starting to have problems, and then you use the cognitive knowledge of that nurse to go and look at that patient and try to assess what the problem is. So what AI can do is, as I said, elevate that resource to spending more time on the patients that need attention and not as much time on the patients who are perfectly fine, right? What efficiencies want our healthcare system to do more with its healthcare dollar.
Okay, no, I think that's really fascinating to put it into context.
And one last thing.
Please.
This is all about trust. So trust and letting. There's this letting go kind of phase. So just like the pilots in that first cockpit, when they said, okay, we just turned on the autopilot systems, and the pilots are holding on to this stick going, or just like the self-driving cars, right? Anybody drive one of the self-driving cars? You got your hand on the steering wheel, and you let go for a little bit, and you see how it goes, and then you grab back on. So there's a process of learning how to trust. How is this going to work? Is it working? Is it safe? Okay. And over time, there's a letting go. And then this just becomes a part of how you do your job.
I think it's such a fascinating analogy, and I definitely think it helps people be put at ease. Thank you for trusting the mic by just going for it. I have a lot of pilot friends, and they rely on autopilot all the time. And they say if it's an extreme, windy, stormy situation, the autopilot will actually land it better. But having that human overview is, of course, but they don't have a reticence. But I wonder, is the medical profession...
It's because they were brought up with it, right? They were trained with it.
Right, so younger medical professionals will...
AI will just be a natural part of what they do.
So it's a generational and the era divide, you're saying?
It's hard to let go of what you were taught, for decades. But it's going to happen very quickly because the benefits are so tremendous. I mean, what we're seeing with this bio button right now, I mean, it's just like this. If you got onto a plane and the pilot said, just for fun, we're going to turn off the autopilot system, you should get off that plane, right? And
parachute at the ready.
Yeah.
Now, where is the bio button? We must return it to Dr. James Mault. Are there any questions? We've got 2 minutes on the clock.
Question.
No. Yes, we do. May we please get a microphone? You can take this one here. Perfect. Thank you.
I don't know if it's dead or not. There you go.
First is my comment that as a doctor, as an AI expert, still in your communication, there's a lot of empathy I can feel. But my concern is, or my question is, that now no doubt about it is connected healthcare, autopilot are going to spread. But how empathy can be ensured that how this autopilot thing will not overshadow empathy, which is the key part of healthcare.
Yeah, I couldn't agree with you more.
Very good question. Thank you.
Thank you.
Yeah, I mean, that's the key differentiator for healthcare is the human interaction, right? And so the good news is it's not an either or proposition, right? As long as we apply AI as tools to help us as clinicians be better doctors and nurses, we can never let go of that human interaction. And just like I said, but the important thing is, as for better or worse, we don't have unlimited budgets in our governments and in our healthcare system. So we have to be smarter about appropriating the human interaction to the people that need it the most, right? So we can just be a little smarter about who we give more attention to. And because right now, we spend a lot of time seeing people in the clinic who are perfectly fine, and not enough time with the people who need more attention, right? And so, I think that's the right thing to do for our economies and for the delivery of healthcare. But there's going to be a lot of kicking and screaming. This is not going to be easy, and we're seeing it right now. There's this phase of healthcare naturally is slow to adopt. So, but I think you're going to see these adoption cycles shorten because the benefits are so tremendous.
Now, thank you so much, because we love our audience questions. So that's a very good one. I know that we are concluding our session here, but Dr. James Mault, it's always fantastic to have you on the stage with us at M42. What might be some of your parting words? We've been speaking very broadly, and we appreciate you being so comprehensive. On biointelligence, in terms of connected health, what might be some of your parting words that you want to leave us with here on the M42 main stage at Arab Health?
Yeah, I think the message is there's no going back. This is happening, and it's irreversible. The benefits are just so dramatically outweighing the risk. There's risks in everything we do in life, but we're going to look back on these next 5 years and, medical history and see this as clearly one of the most profound moments in human health.
I think that's such a profound moment to end on. You did say that there is a divide in the generations in terms of embracing technology. The fact that you are a heart surgeon and you're fully embracing it means that you must be young at heart. And on that note, I can't outbetter myself on that. A big round of applause to Dr. James Mault.